Get ready for a shake-up in how GP contracts are decided in England. For decades, the British Medical Association, BMA, has held the exclusive power to negotiate these crucial agreements. But that's all about to change, and is sparking quite the debate. The government is poised to overhaul the system, effectively diluting the BMA's long-held influence, starting with next year's contract. So, what's the big deal? Since the very beginning of the NHS, the BMA has been the sole voice representing GPs in these negotiations. This meant they had significant leverage in shaping the terms of employment, pay, and working conditions for family doctors across England. Now, the government wants to bring more voices to the table. Instead of solely relying on the BMA, NHS England will be consulting a broader range of stakeholders, including the Royal College of General Practitioners, RCGP, the National Association of Primary Care, NAPC, Healthwatch, National Voices, and the NHS Confederation. This marks a significant shift away from the BMA's exclusive negotiating power. The stated reason for this change? To foster a more constructive dialogue and ensure a wider range of perspectives, including those of patients, are considered. And this is the part most people miss. It signals a fundamental shift in the government's approach to primary care, moving away from a system where one organization held almost all the cards. But here's where it gets controversial. This decision follows a period of strained relations between the government and the BMA's GP Committee. Meetings were even cancelled while the government reviewed the relationship, fueled by a dispute over whether recent changes mandating core hours online access were agreed upon or imposed. The BMA claimed the changes were forced upon them, while the government insisted they had been agreed to. This disagreement underscores the tensions that have been simmering beneath the surface. NHS England's primary care director, Dr. Amanda Doyle, recently addressed the situation in an exclusive op-ed, stating her commitment to listening to concerns and working collaboratively as consultation for the 2026-27 GMS contract begins. She emphasized that while the GPC will be consulted as usual, the process will also involve a wider group of primary care stakeholders, including patients. Now, let's get into the nitty-gritty. While the Department of Health and Social Care has a legal obligation to consult the BMA on the Statement of Financial Entitlement, SFE, it appears this will be limited to a single session. The BMA, along with each of the other stakeholders, will reportedly be granted only one session to discuss the upcoming contract. This raises a crucial question: is one session enough to address the complex issues at stake and ensure a fair outcome for GPs and patients alike? The NAPC, for one, seems ready to participate. A spokesperson stated that as a membership organization, they are well positioned to share the views of their members with the DHSC. However, Primary Care Minister Stephen Kinnock made it clear that talks couldn't proceed while the BMA was threatening industrial action over a contract the government claims the GPC England fully agreed to. The situation escalated earlier this month when the England LMC conference backed motions to potentially include full-day walkouts, undated resignations, and refusing online access compliance. However, GPC Chair Dr. Katie Brammer later clarified that there were no current plans for ballot on industrial action. This raises some interesting questions. Is the BMA's threat of industrial action losing steam? Or is this a strategic pause to reassess their options? Furthermore, how will the government balance the need to consult with multiple stakeholders while ensuring that the voices of GPs, who are ultimately responsible for delivering primary care, are adequately heard? What do you think about this significant change in how GP contracts are negotiated? Is it a positive step towards a more inclusive and patient-centered approach, or does it risk undermining the representation of GPs and potentially jeopardizing the future of primary care in England? Share your thoughts and opinions in the comments below.